Hi everyone. Today we will discuss about very commonly asked drug in exam, that is atorvastatin. Atorvastatin, it is an HMG-CoA reductase inhibitor and it belongs to statin family. Other drugs from this class are lovastatin, simvastatin, pravastatin, atorvastatin, rosuvastatin and pitavastatin. Out of these drugs, rosuvastatin is the longest acting drug, and after that atorvastatin is another longer acting drug. Food can increase the absorption of all these drugs. Exception is pravastatin. Pravastatin absorption is not affected by food. Now coming to the mechanism of action of statin, HMG-CoA in the liver is converted to mevalonic acid with the help of the enzyme, that is HMG-CoA reductase. Now statin will competitively inhibit this HMG-CoA reductase enzyme, and this step of conversion from HMG-CoA to mevalonic acid is a rate limiting step. Mevalonic acid is ultimately converted to the cholesterol, and as statin inhibits the rate limiting step, it will ultimately decrease the cholesterol synthesis in the liver. As there is a decrease in the cholesterol synthesis in the liver, ultimately liver senses the low level of the cholesterol, and that will result in compensatory increase in the LDL receptor expression on the surface of the liver, and that will ultimately result in increased LDL uptake from the liver into the blood circulation. So that is the beneficial effect of statin, and this is how it can result in decrease in the LDL level. Maximum activity of the HMG-CoA reductase is at the night time, and that is the reason statins are usually given at night time. Now coming to the pharmacological effects of the statin. Statin can decrease the level of LDL cholesterol, total cholesterol and VLDL, slightly increase in the HDL level, that is beneficial effect of statin, and this is cardioprotective action of the statin. It can have pleiotropic effects. Statins are having antioxidant, anti-inflammatory and anti-proliferative effect, and that decreases the risk of stroke and myocardial infarction. Apart from this, it also improves the coronary artery compliance, atheromatous plaque stabilization, and as it increases the nitric oxide release, it can improve the endothelial function and also decreases the LDL oxidation. So these all are the cardioprotective action of the statins. Now coming to the clinical uses of the statins. In primary hyperlipidemia, where there is a raised level of the LDL and total cholesterol, and type 2A, type 2B and type 5 hypercholesterolemia, in all these cases, statins are the preferred drug. Statins are also used for the prevention of the myocardial infarction, for prevention of the acute coronary syndrome, to prevent the acute attack of angina, and also in the prevention of the stroke. Statins are also preferred in diabetes and nephrotic syndrome patients who are having dyslipidemia. Statins are also given in post-angioplasty patients, and statins can prevent venous thromboembolism in post-knee and hip replacement surgery patients. So these are the clinical uses of the statin. Now coming to the adverse effects of statin. Statins can cause myalgia, that is muscle pain, myopathy, rhabdomyolysis, which is a rare but serious side effects. It can result in elevated liver enzymes, that is serum transaminase. So when you are giving the statin to the patients, liver function test monitoring is required. Coming to the contraindications of statin. Statins are contraindicated to use during the active liver disease, and it is also contraindicated to use during the pregnancy. Now coming to the drug-drug interactions of statin. Atorvastatin, it is metabolized by CYP3A4 enzymes, erythromycin, clarithromycin and ketoconazole. Ketoconazole is an antifungal drug. If any of these drugs are given together with the atorvastatin, then it can increase the risk of myopathy. You have to closely monitor for the drug-drug interactions and also monitor for the liver function test when you are giving atorvastatin for the long-term therapy in the patients. If you like the video of atorvastatin, subscribe my channel and follow for more pharmacology related videos. Thank you.